Development Nexus. He's really, what he's talking about is what many people term the Humanitarian Development Peace Nexus, or some people talk about it as the HDP Nexus or the Triple Nexus. It's not a new idea. It's an idea that emerged really from the humanitarian community. The World Humanitarian Summit in 2016 endorsed the idea that peace is as important a pillar to be taken seriously as humanitarian response and as development work. And it's been endorsed by the OECD DAC. There was this whole resolution that came in May 2020. So this is a concept that now is gaining ongoing momentum in our field. And it emerges from two really critical insights. Most of the worst humanitarian crises that we're facing in the world today stem from conflict. They stem from violent conflict, and they stem from forced displacement, and also an inability, a lack of cohesion in societies to be able to respond even to the natural disasters or other sorts of crises that may be emerging in a society. And the second key insight is that the countries which have, and the places which have been unable to make a lot of progress against, well, literally the Millennium Goals and the SDGs, are places affected by conflict, places that are highly divided, where governance is there's major gaps in governance. There's a true lack of cohesion among different aspects of society, where divisions are rife and where military or armed action are natural pathways to be used to resolve differences, or adversarial approaches to conflict are being used. And from those two insights comes this field of peace building. And the field of peace building is, it's serious, important, hard work. It's a newer field, less mature than, say, public health, many fewer years in a way of history. But it is a growing practice. And it is a practice of addressing inequities in society, addressing decision-making, creating and facilitating relationships among people, between different factions, different political factions, different groups of ethnic groups, the array of divisions that exist in any diverse society, and facilitating healthy collaboration to resolve and address the key problems and pursue shared vision. And this is really something that needs to, and fundamentally needs to, underpin all of the different work that all of us are doing. COVID-19, I think, has laid bare the gaps in all of our fields. It's laid it bare. We can see that in more marginalized communities in every society, including the most wealthy societies in the world. It's those most marginalized communities which are suffering most from the COVID-19 crisis, and are being disproportionately affected as well by the response. The divisions that we see in societies, including places that have not been deemed traditionally fragile, including the United States, Europe, and other places, divisions in different parts of society are absolutely inhibiting our ability to respond to the crisis in an effective way, and enabling the virus to be, to flourish. And so I think it's really time for all of us and all of our agencies to be thinking about, how do we actually take peace building as seriously as we take our humanitarian response and our development responses, and understand that the humanitarian actions and development actions go beyond do no harm, beyond just conflict sensitivity, but actually can be profound, have a profound and enduring effect on the way conflicts are addressed in any given place. So I'll stop there. I'm really looking forward to the discussion, the back and forth here, and hearing from others. So thank you.
Thank you so much. Thank you, Patty and Michael, for those opening remarks, and again for our co-chairs. The first question I'd like to follow on with that, Michael, and the first question I'd like to ask you, in your opening remarks, you noted how the humanitarian to development nexus should be the humanitarian to development peace building nexus. Can you elaborate on the importance of considering peace building as an integral element of longer term development that is born out of humanitarian relief? And further, is there space within your construct of the framework to address multi-sectoral and or whole of government approaches?
So absolutely. Firstly, this construct, the construct is not mine or anything like that. This is a construct that's gained momentum, that emerged, I think, from some of the insights in the humanitarian space. So to answer your question, I think that if we look really practically on the ground, what we're talking about is how how do you recognize and address in any kind of given development intervention the effects that may have on the way in which conflict is managed in a society? And so we've increasingly understood in our field that distrust in government in particular, or the gap between citizens and the state, is a core driver of violent conflict everywhere. So this is both stems from the idea that in many places state services are not really being accessed by many people, and when they are, it's often inequitable. Groups of people are marginalized from accessing it, or their only experience with the state is actually experiences of human rights violations. And so when doing a security sector reform or working even on fundamental service delivery in a place, one really has to look at what is the actual relationships among people, what are the actual potential for collaboration among people, both across the different dividing lines in any given community or society, but also between the broader citizenry and the state. And we can see case after case where that collaboration has yielded profoundly improved development outcomes. So, in Sri Lanka, for instance, after the war, where this was a huge issue, there have been huge efforts made to bring about improved relationships between citizens and government in communities across the country, particularly marginalized communities. And we've been a big part of that at the relational side. And what we're seeing is that it enables government to be much more responsive to the needs of their people, but also by listening and engaging civic groups and citizen groups in that solution. And this is as much true in humanitarian crises, although acute and more compressed timelines.
Well, thank you, Michael. David, why don't we put up that poll, just kind of see based on what Michael has said, what the audience is saying on a scale. So you can see, Michael, there, if you can see the results on your screen, that 10%, 27% have some integration of peace building, but really nearly 44%, it's not even really an issue. So I think that this is really, this discussion today is really useful. Now I wanted to kind of swing back over to Patty if I could. And Patty, one of the questions that I have, maybe hopefully building on what Michael is saying and perhaps contrasting, with the arrival of COVID-19, which has created a virtual community overnight, as countries in Asia, Africa, the Americas went into lockdown in lockstep with most European countries. What opportunities do you currently see in terms of bridging the humanitarian to development divide, in alignment of funding streams, which in the past have not been able to intersect at that nexus? And perhaps based on your opening comments, it's maybe a very different response than I might have anticipated, given how you've framed the poverty aspect of the humanitarian side and the humanitarian aspect of the development side. What are your thoughts?
Yeah, I mean, first I would just like to highlight that feeding off of Michael's comments, I do feel that there's probably more peace building activity in very simple kind of Simon ways happening than organizations acknowledge. And that's one of the challenges we have is, protection work and the complexities of how you do that, really listening to communities, being locally driven and locally led. Those are all going to help us address this nexus in many ways, because people on the ground who are impacted, they're not looking at humanitarian response, development response, peace building response. They're just looking at, what do I need? And I think the challenge to all of us, and I think we are seeing this through COVID-19, is listening to what people need and actually giving them what they need. Not giving them, again, sorry to pick on this, but what a donor far away or a central government or someone else thinks they need. And so for me, this is somewhat to do with the nexus, but it's more to do with how we, as a sector, humanitarians, development, peace builders, how we all work and how we have to kind of break down a little bit of the paternalistic perspectives that we have of knowing what people need on the ground, instead of actually taking the time to listen. And I bring this to COVID because I feel it's really important at this current moment, even if you just take the US as an example, and apologies to those of you who are internationally, I'm not trying to be US centric, it just is very visible in the US. We are the largest country impacted right now in terms of COVID. One could say, have one of the worst responses happening right now in terms of COVID. I do think it has, humanitarian development and, political aspects to it that make it all what it is right now. And what Center for Disease, now I've done it to myself, Julie. Center for Disaster Philanthropy has done to change is, well, not to change, but recognizing more and being more flexible in this is, our funding, especially in this latest tranche, we are really asking the communities, what do they need? And it's surprising the responses we're getting, because in the early days, it was very much a lot of what you would expect, feeding programs, access to schooling, all the usual, that medical, of course, a lot of medical. But now we're getting requests like rental payments, cash programming, right? Or census, help with the census, help with voter registration. And when I got the first few of these that I got across my desk, I said, well, hold on a minute. This is the response for COVID. How is census a response to COVID? And the organization, wrote, basically had already explained this, so I didn't have to ask them directly. I asked my fund director, and she said, well, because without the census, they're not getting the appropriate medical care into their community. Without the appropriate medical care into their community, they are getting hit harder with COVID. So no, it doesn't respond to the current response, but for them, that's the most important issue. That's the critical issue. We need to be counted, and we need to be making sure this does not continue to happen. And I think the other thing with COVID that's so interesting is the way it has now given rise to the racial justice movement in a way I think hasn't before. Of course, the killing of George Floyd had a huge part in that, but I think the receptivity, the recognition that an enormous part of our own population is more at risk to this disease because of the generations of maltreatment and racial inequities has forced everyone to kind of look at it in a different way. And I do think you can't separate them. I do think they are interconnected, and thus the solutions for one may be addressing the other. And in the traditional models that we had for humanitarian development, for even peace building, would be like, I deal with my silo and someone else get that. Mm-hmm. And I think what we need to do more of is say, what are people saying that they need? And how do we find a way to give that? And this is where I will challenge us as a community, the nonprofit community, because the fact that the UN doesn't fund it or lead on it, the fact that the donors don't fund it or lead on it, that's on us. Why are we not demanding that they change? Why are we not submitting co-proposals to OFDA and USAID and just saying, hey, you know what? Like in the old days with Food for Peace, when you submit it, you got food from Food for Peace, you submitted a proposal to OFDA to support it. Well, if you're doing an RFP for USAID, why are you not doing a humanitarian component to OFDA saying these are companion programs? We need to get better at that. And many organizations on this call are multi-mandated. So it's not a question of I need to find a partner. You just need to walk across the hall and talk to the humanitarian folks. So I just think for me, the COVID gives us an opportunity, back to your question, it gives us an opportunity to really challenge ourselves and to look at how we're changing, to gather that evidence. And when we're through this crisis, which will take years, but when we're in the recovery phase of this crisis, let's push back and say, you know what worked? Funding census. You know what worked? Voter registration. You know what worked? I mean, just kind of push back to the I know best from afar mentality. And I think from the philanthropic community, you are seeing this. There's a lot more flexible funding going out into the community. There's a lot more sustainable funding being given to try and help rise this. The bilateral, the UN, I'll be honest, you're not seeing a lot of money go into this crisis. And that concerns me, at least not to the nonprofits. You're seeing it going to the multilaterals, you're seeing it go into governments and government structures. But I did an analysis of the financial tracking system of the UN, and big numbers going into the UN, not a lot going out to the NGOs and the local NGOs, which then gives me pause, because are we actually in this crisis doubling down from far away, I know the solutions, versus actually challenging ourselves to say, you know what, get it out, get it, take the risk, own the risk, and put it out into these communities, because we have to do this to resolve this. So we have an opportunity in COVID. I have to say, 4 months in, I'm not seeing that the large actors that hold the power in this are actually doing what they need to do to address the change to come out on the other side of this with that mentality. I'll pause there.
Well, thank you, Patty. And I think this is why it's so important that we're having this discussion, and why I appreciate so much that you've agreed to join us today. My early days of emergency, my first entry point to emergency had this separation of these funding streams, and it was 20 years ago, and we're still today grappling with this. Last year, when I was in the Somali region of Ethiopia, I welcomed a VVIP. 12 people from the Swiss cooperation came, and we had one development representative and one humanitarian representative, and each of them were representing their funding portfolios. And I asked them why we couldn't combine them for this very reason, and they said that it was legally mandated. Yes. So we do have advocacy to do, and which is why I wanted you to come on here, so we can identify these issues and we can start pulling out some advocacy points, and we can break this down. It's time, and COVID is not going to allow us. Just to pick up on something you said earlier about the US, I read an article today by a brilliant journalist out of Nigeria. And as he was talking about the states in Nigeria and they're grappling with the COVID and how 2 of the states were rogue, it was as if I were reading the United States, and it was really interesting. We are in a very different time. So with that, what I'd like to do is shift over to Michael and maybe start to look at some ways that we can actually address this. And Michael, in our call on COVID and conflict in May, you noted that the global COVID response is an opportunity to strengthen collaboration on many levels. What are these opportunities specifically, and how do you contribute to, how do you think that this collaboration, potential stronger strengthening of collaboration, can contribute to longer term development?
Excellent. Thanks, Julie. May I just make one little small point in relation to first of all, Patty, your comments are just so well taken. Just a quick comment on the funding. You know, one of the challenges is that humanitarian funding is very short-term in nature, even though we know that most of the crises, as you mentioned earlier, are not short-term. You know, most crises are going on 7+ years. You know, if you're trying to fund programming in South Sudan today, you're getting funding in 6-month increments or 9-month increments. What kind of enduring change can you bring about in 6 or 9 months? You can distribute some rice, and then you're, you know, going through the cycle again. And we know that almost all the development and peace building outcomes that we're seeking to accomplish are generational. They're you know, decade long, and the donor investment in that sort of change in short, you know, in short bursts is ineffective. So the money and how change occurs don't exist in the same way. And I think this is a huge problem that we're facing.
Michael, you know, I don't want to interrupt you, but what I would like to ask is, we did do a poll a little bit earlier. David, was there anything that we were waiting for, or are we good on that? Yeah, so, we had already done that. We had released that. So excuse me, I wanted to make sure that we had that. Thank you, David. So Michael, do you want to continue on then with the question about collaboration?
Yeah, absolutely. So that we're seeing around the world several things happening. One is that in places where there is fraught conflict, there are efforts to try to bring about sort of a cessation of hostilities. It's been stop and start. My colleague Shoki can speak about how this is manifested in Yemen. Saudi Arabia had a brief ceasefire, but we have seen cases such as in Myanmar where there have been you know, overt efforts to bring armed organizations, in that case, the ethnic armed organizations, the EAOs and the government together to look at how they could create joint responses. And, you know, and so there's a moment here to say, well, we're facing a calamity that's much more serious as an enemy than we are to each other. And we're not going to be able to stop that enemy, a virus, unless we actually cease hostilities, work collaboratively to get sources and resources out. And we're seeing this happen in places. The other kind of collaboration, there are two others. The other kind of collaboration that we're seeing is around the collaboration between citizens and media. I'm sorry, government and media. The information ecosystem is a huge problem in the COVID-19 response. We're seeing rumors flowing, and people operate in different information ecosystems, and so we are seeing in many places, we're part of this, where government ministries of health in particular are reaching out to media and seeking to work together to disseminate a cohesive information, a set of information to the public. And what's really been powerful about that is that it's like new voices that are actually genuinely credible with the broader public, which are suddenly getting platforms. So it's not just talking heads, sitting in a capital city, but rather, that dynamic youth leader who has a huge following, or religious leaders who are having a following. And then I think the most important one for yours is a collaboration that's existing now between broader citizens groups and state institutions, particularly the local level. And we're seeing this happen in many places where, Patty, you talked about how, from our community, we struggle and fail very often to really listen to people. This is a problem of governments as well, and institutions. And there are plenty of cases where a lack of engagement with citizenry about what they need in the COVID response has led to real tension, even clashes, even violence. But there are also plenty of cases where local health commissions, or whatever it may be in each place, are actually creating consultations with communities to understand, well, what does social distancing mean in this context? How do we handle it, in terms of this particular culture or economic realities? That collaboration builds trust. And if there is a response that has some outcomes in dampening the pandemic in places, well, those outcomes will endure. People will understand and see that, and grow trust between citizens and state actors to be able to collaborate on the array of other development challenges that are facing them, some of which are maybe much more acute, like food security, education access, things like that. Mm-hmm. The core insight for us has been that where we see collaboration between citizens group and states, and where there's channels for people, particularly from the most marginalized communities, to engage with state actors, to bring their voices, their ideas in credible ways. And there's a capacity in the state actors, their people, right, to mm-hmm. listen, to understand and engage. Well, we see improved policies, improved action, improved service delivery, all of those core fundamentals, which are essential for ultimate development outcomes. So that's kind of what we're witnessing, and trying to take advantage of those three pillars.
Well, thank you so much. And I think that really gives us a nice kind of, again, frame to look at this. I want to make a note that there's some really great comments in the chat box. First of all, great points, Patty McIlreavy. This is what I have been expressing for a long time now. Thank you for bringing it to light. And also, Michael, something I'd like to ask you to comment on, if you would agree. Ann Kuntz says, in the past 30 years, the past 30 years has seen a range of triples come and go in both humanitarian and development fields. While I agree peace is an essential element, there are other elements needed, and prefer to work with the goal that all of us, including local community and stakeholders, understand the system and all the factors needed to reduce vulnerability, fragility, and poverty. And you've really brought this peace building piece to the call today. So I just wanted to give you an opportunity to respond to that comment, if you would.
Yeah, absolutely. I mean, I know our field, it has I saw the comment, and it's great. Thank you for that. And yeah, I mean, our field has concepts come and go all the time, right? And so we deal with the concept of the day in a way. It's one of our weaknesses overall. Look, I think that what we are seeing is that development outcomes can be erased in a flash of an eye through violent conflict. To me, how many billions and billions of dollars have been spent on humanitarian response and development work in the DRC? And yet the DRC has been, 23 years plus, has been consistently one of the most severe humanitarian crises in the world. Why? Because we're not actually addressing the core root causes of why there is a humanitarian crisis ongoing. We're not actually looking at fundamentally what is driving violent conflict there and seeking to change that at every level. Because it's not just about like bringing, people often think peace building is like bring people in a room, play some soccer together. It's not. It's about saying what are the core drivers of conflict at every level, from the highest political level down to the community competition over resources or whatever it may be. And how do we create ways for people to work collaboratively to address those root causes in a way that fosters interdependence? And without doing that, we can do all the development work we want, but we face an enormous level of vulnerability to have it erased and convert it right back into a humanitarian crisis. And I think that, so the lack of resiliency that comes with not addressing the core way in which we handle our differences, it's just it's a very high risk. And we can see this from society again and again, many places. So it's not that I'm like advocating this nexus or this triple, right? The concept is fine. To me, it's about saying, how do we actually address what's happening here? What's driving the lack of development progress and driving all of these humanitarian actions? How can we actually target and drive resources into that place? And for me, the thing for the humanitarian development actors, the last point to say, Julie, is I think people working in that space, and we do often try to create, we have a principle of humanitarian action as being non-political, and yet it is hugely political. The choice of who your distributor of rice is hugely political. Your choice of every single decision that you're making as a humanitarian actor, development actor, has political implications on relationships, resource distribution, and inequities in a society. And so we need to actually embrace and acknowledge that and hold that every action, whether you're building a road or distributing rice in a refugee camp, is inherently going to affect the way in which conflict is dealt with in a society. And so how do we actually transform it? And that's the core idea here.
Can I just add to that, Julie? Because
Please.
I think just one other thought I want people to think about, to ponder, is because it kind of ties what Michael was saying is, who are we choosing? How are we choosing? What are we thinking about? And Humanitarian Development Nexus, I mean, I don't think there's many people you're going to meet that don't say that we fail at this, right? But I think the key issue there is the subject of that sentence. We, the internationals, and how many countries actually succeed at this every day? Indonesia has like a disaster every day, I think it is, and yet they manage to respond. They are still working forward on development and having humanitarian. It's not without faults, every country has faults, but how many countries actually succeed at doing just this? But we focus on how we do, who we are, where we are, the role that we have. And so I feel like in some parts we're choosing poorly. And then the countries that the UN has chosen for the pilots, for the Humanitarian Development Nexus to work, it's like choosing the hardest things we can choose. It's Nigeria, it's DRC, it's Afghanistan. Really, why are we choosing like the hardest out of the gate? Why are we not exploring the countries that actually just need a little bit of a boost, a little bit more of the development actors taking and helping them on the humanitarian side? But it's because we always want to put we into the solution. And I think that's another one of the challenges we have as we look at this is what can we learn from the countries that are actually doing this already and doing it well without us? And what can they teach each other? And how do we create the space for that conversation to happen? How do we create the space for our own donors to listen to those countries about what kind of development programs they implemented that helped them get there? What peace building programs they implemented to help them get there. So I do think it's a question of us also giving ourselves a little bit of a hard time about where we look at doing this, why we look at doing this, and sometimes it is for the wrong reasons. If I look again at why some of the Humanitarian Development Nexus kind of popped up heavy after 2016, part of it was in response to the World Humanitarian Summit, part of it was in response to this bigger issue. But part of it, I'll be honest, was in response to wanting money from other pots. And I go back to the UNDP, the leadership, sorry, I've forgotten her name, from the Kiwi. She basically said it outright in a meeting. Like if I can get money from other pots, why wouldn't I do that for development? And that automatically creates a mistrust and a sectoral challenge and competition. And we need to move beyond that as well. So I do feel there's a space there for looking at that.
Thank you, Patty. We're going to shift now. Based on this discussion, I want to thank the co-chairs and also Patty and Michael, who are going to remain engaged in the chat box. I think it's time now to do a couple of things. First of all, the Cammi from our co-chair has asked that we ask you, where have you had success in collaborating with donors to implement programming that is community focused? You'll see there's a question I put in the chat box, and we would ask that you look at that question, and as we go into the case studies now, could you please share with us where the successes you've had with coordination, and how did you go about, excuse me, addressing this with donors? Resilience and coordination was actually what I said about the in-country, that kind of popped in there too. So that's one question. The other thing is, David, before we move into the case study, we have one more poll. And we would like to put that up for you as we transition. Again, we thank Patty and Michael, Sarah and Cammi for your thoughts. We will have a few minutes at the end for some more questions, and then we will be asking our guest speakers to make some closing comments to close out the call today. Roisin, you're up on deck. We have the poll up. Which of the following areas are you most interested in learning more about? Please make your choice. And Roisin, if you can prepare, I would like to hand the screen over to you.
Absolutely. Thank you so much, Julie. And listening to you both, Michael and Patty, it has been so refreshing, because I do think that as Iraq is known as one of the triple nexus countries, that we do constantly grapple with this, and we do, quite frankly, need to challenge ourselves more. So today I'm going to talk about how Mercy Corps Iraq has been supporting camp and non-camp communities through COVID-19, really focusing on that longer term thinking while ensuring that we are implementing an emergency response. Next slide, please. So my name is Roisin Mangan. I'm the Policy and Advocacy Advisor in Iraq. As Julie was saying, I should be based in Iraq, but was evacuated to Ireland. So just very quickly, I mean, as we continue to talk about how this humanitarian development and peace building nexus continues, Mercy Corps has been in Iraq since 2003, and we have spanned our programming and continue to span our program across humanitarian development and peace building, really focusing on the most vulnerable communities, including those that have been displaced and also refugees. We're currently operational in 8 governorates across North, South and Central Iraq. Our major focus continues to be WASH, cash, livelihoods, social cohesion and education, and our speciality continues also to be that cross-cutting multi-sector approach that allows us to adapt and pivot as the context constantly evolves. Next slide, please. So as we all know, Iraq is a post-conflict context. It has been battling and grappling with decades of conflict, the latest one being obviously the most brutal with ISIS. So, as you were saying earlier, Michael, there's a large formal and informal security presence that remains dotted throughout Iraq. We still have 4.1 million people in need of assistance, 1.4 million people remain displaced, 269,000 of those people reside in camps, while also Iraq hosts nearly 250,000 Syrian refugees. Again, going back to what we're talking about, volatility and a different context. So there's protests in Iraq have been ongoing since October 2019, with over 600 people being killed in violent crackdowns. Now, add all of the previous and pre-existing volatility to the COVID impact. So we started, the first case in Iraq was reported on the 24th of February in southern Iraq. And right now we've been spiking and respiking to about 2,000 cases of COVID-19 per day. Next slide, please. So I wanted to go into a little bit about the specific challenges that we're facing under COVID-19 times. One has constantly and will continue to be our access restrictions. So from a very practical and pragmatic approach, we have faced and continue to face delays and postponements of activities, including emergency response activities, such as the delivery of hygiene kits. Also, just because COVID-19 has added a new layer of crisis onto Iraq, that has not stopped the high rates of return and displacement. So currently in Nineveh, one of the most conflict-affected governorates, we're actually facing unprecedented return rates. About 8,000 people have come from Kurdistan, which is North Iraq, back into Nineveh, into areas that are not fit for areas of not fit for conditions for return, and they have no basic facilities such as water, such as electricity. In terms of the actual COVID-19, there's been limited data around the government response and the caseload, and this has resulted in increasing social cohesion tensions as we have seen across the world, but specifically towards the government around specific protests and also within communities. So misinformation, lack of correct information, rumors, they're all rife right now in Iraq. And because of the stigmatization from specific groups, we're specifically seeing the Iranian population or the Iranian affiliated population specifically stigmatized because of the porous borders between Iraq and Iran. And as we all know, Iraq is known as the global hotspot. Next slide, please. So then the question that we're all here today, you know, the bigger picture, how do we operationalize the Nexus? So I think, you know, both Patty and Michael and Julie, you were also saying, for me or for us as Mercy Corps Iraq, it goes back to community focused, community led, and making sure that we are listening to the communities. So so when we were thinking about how to start our response for the COVID-19 in Iraq, the first thing was how can we address the first and the primary impact of COVID-19, but also the secondary impact, as they were and continue to be drivers of social tension. The second one is to ensure that we are focusing both on camp populations and out of camp populations. In Iraq, sometimes a lot of the focus does tend to be on the camp populations, specifically in some of the most conflict affected areas. So you're looking at the likes of Salahuddin, Anbar, Nineveh. The third was to leverage and to mobilize our existing relationships with government and also community, ensuring that we're talking and engaging with committees, local leaders, women, youth. Next slide, please. So in terms of our strategy, it was a three-pronged approach. And again, you know, from what you were saying, Patty, it definitely was very much of a we approach. But the first thing we did was realign and adapt our programming. So that was through working with both the governorate, so both federal and the governorate level WASH and health agencies, to identify where those needs were, where those locations were, and then also to engage with our community action groups, which have been pre-established or pre-existing community action groups, and to work with them to assess and identify the needs. The second one is coordination, our favorite word as humanitarians and development actors and peace building actors, but we again broke it into three parts. So in terms of government, so similar to across the world, Iraq faced heavy lockdowns, extreme curfews, extreme restrictions. So we really had to coordinate with the government to ensure we could get access letters and exemption letters so we could travel these roads and go to the camps and go to communities. The second one, and most importantly, was the community. Work with the community to identify the needs. And then thirdly, again, as you were saying, Patty, that reflection of what we need to do. So internally and externally in the response. So internally within Mercy Corps Iraq, we had to ensure information sharing, technical expertise was being streamlined across our programming to ensure that we were not doing siloed programming. And also externally, you know, there's a number of actors and agencies in Iraq and everybody rushed to do COVID-19 response. So we had to ensure through cluster systems, through bilateral engagements, through multilateral engagements, we were avoiding duplication on the ground. The third one, and the most important again, is that ongoing monitoring and ensuring that what we as Mercy Corps is doing, is actually addressing the needs. So this was, as we continue to expand or into different locations, as we continue to scale up our programming, we constantly and regularly engage with our field colleagues. Also, we undertook a number of rapid perception assessments, which really understood what the impact of COVID-19 on the communities were. And thirdly, which was quite interesting, was we were tracking the narratives and rumors from both social media, because that was rife and continues to be rife in Iraq, and also within the community. Next slide, please. So in terms of, I'm just going to take a few moments now to talk about our actual programming. So our actual programming is conflict-sensitive humanitarian action. And, you know, again, buzzword, that's always a buzzword. But what we did was very, very clearly lead from the community upwards. So we, as I already mentioned, we have community committees. They're pre-existing, they're already established. So what we did is we worked with them to define the drivers of social conflict within the COVID-19 and to ensure that they were identifying the major priorities. Also, you know, because they're pre-existing, they already have their long-term social cohesion strategies. They've already identified what they want to fix or how they want us to support them in their community. So it was working with those strategies to ensure that we were adapting them to meet the immediate needs of the COVID-19 response.
Roisin, this is Julie. I just want to ask if you could just kind of start to wrap up a bit.
Absolutely, thanks, Julie.
Thank you kindly.
So the third one was around the collaboration with the government. So as our action plans were being developed, we had to make sure we were validated by the government. Next slide, please, David. So then in terms of our actual interventions, I'll go quite quick through them. So the first one was addressing the misinformation, two-way dialogues, hygiene promotion campaigns. The second one, hygiene promotion and hygiene kit distributions. So for example, we had 10 to 10 promotion reaching 114,000 people. The third, ensuring that our community committee trainings, they were capacitated, including around social media events. Next slide, please. Also, you know, we are humanitarian in Mercy Corps Iraq as well, so we had to directly address the wash and health needs. So for example, you can see on screen 3 examples. So we rehabilitated a quarantine center that was for 1,500 patients to serve 20,000 people. We rehabilitated a number of water treatment plants that will benefit 20,000 people, and we continue to scale up our water trucking. Next slide, please. So in terms of lessons learned, 3 very key lessons. 1, strengthen coordination with the government at early stages of program implementation. This was to improve our access. Secondly, to ensure all our programming as we continue to realign and expand to ensure it's conflict sensitive and adapted per the community needs. And thirdly, and very practical approach, was to develop the immediate SOPs and standing operation procedures for all programs working in a COVID-19 response. Last slide, please, David. So finally, in terms of the conclusion, so, you know, we're all here today to talk about how we can integrate the development thinking into the humanitarian response while also addressing the conflict drivers and the root causes. We really have to refocus and shift to support the existing and already functional community advocacy structures, because they do form the vision and foundation for good governance. And thirdly, it's to elevate the civic participation so that people can hold their own governments to account and demand for extra public service delivery. Thank you.
Thank you so much, Roisin. I think David has some results, and we'll see kind of the areas where most are interesting. Roisin, this question was encouraged and inspired by your presentation. And what's interesting is of the 5 potential answers, adaptive management is of most interest to all. So thank you all for participating in that poll. As we prepare for Shoki and thank you also, Roisin, for your wonderful presentation. I also, before I ask Shoki to come on, I just wanted to share a comment from the chat box. from Nadita Shugati. I hope I've said your name correctly. She says, hi all, thank you for the really great discussion. I have learned a lot. As a general pediatrician, I've been focusing on pediatric HIV and working in the HIV space, which has lots of money, but I am increasingly frustrated by our failures to make progress for children. But this is partly because we are so focused on a biomedical response to what are really social issues. Competition for funding for yet more technical innovations has destroyed us. Pediatric HIV needs a humanitarian response, it is said often, but I don't know that the HIV response actually knows what that means. So those are so paramount to issues that we're talking about today. With that, we're going to do another short presentation, and Shoki, I'm going to ask you to keep to 8 minutes so that we'll have some time to do some closeout. And now the screen is fully over to you. Thank you. Okay. Shoki?
Thank you. Thanks. So I'm also throwing in a new term, the triple nexus. So what I'm going to be talking about is within the MENA and mainly focusing on Yemen, how we approach conflict sensitivity as one of the dynamics into the triple nexus. Introducing myself, I'm the senior conflict sensitivity advisor in search for MENA, covering Yemen's as a priority countries, Yemen, Iraq, Lebanon, and Syria. And previously I worked as the Yemen country director responsible for our programming in Yemen over the last 7 years. Next slide, please. So just to give a framing how we approach this and how to do the linkage. So in our thinking, the triple nexus, like for the three sectors to work together, conflict, humanitarian assistance, developments, and peace building in a form of triple nexus is a normal evolution for conflict sensitivity. In some cases, that is have two different perceptions where conflict sensitivity means an integration within the different sectors regarding how they interact with the context and trying to achieve a positive impact, while the triple nexus looks at more of like an overall coordination between those different sectors. One of the assumption that's bring that also to the focus is that actually even peace building would need conflict sensitivity. Peace building is not another side of conflict sensitivity, or conflict sensitivity is not another side of peace building. If we are going to aim to achieve a change, which needs to be sensitive to the side effect of that. Then conflict sensitivity means that we need a holistic approach, which means that in order to change a context, we cannot approach it only from humanitarian side or from development or even peace building. We need to have an overall collaborative influence between those sectors in order to transform the context into a context where those three different sectors are not needed anymore. As Betty was saying, that I mean, in some cases, countries actually has learned how to do that themselves, so they don't need us, and we can learn from that. Then the other thing is this fact that if we want to have that holistic approach where we are trying to transform the context, interaction with political level is unavoidable, meaning that the way that's normally humanitarian or developments avoid to interact with politician and mostly humanitarian talking about neutrality. If we want to transform the context, that should be changed, and we should approach the political level, because whatever we achieve in the ground, a small changes in the political dynamic can ruin all that. The other thing is that peace building, and I'm not talking here is like, if we want to achieve peace building, that cannot be achieved by peace building sector. I think that is a fact. We need the three sectors in order to achieve peace in any given context. Next slide, please. So let me give you some examples from Yemen where this kind of interactions happens. In Yemen, we've been operating for the last 10 years. So during the last crisis, we've been working in one governorate, particularly in Taiz, where we work at the district level to build what we call it structure for conflict resolution. And means that we identify certain influencers and we give them capacity building and help them to actually help their communities in dealing with difference, conflict in their context. One of the finding are, that we find that's following this, when we build that structure, the access of humanitarian assistance into these areas become much easier, because humanitarian assistance would come and immediately tap into those existing resources. So those people were able to facilitate access, they were able to facilitate distribution, they mobilized the community, and the community understand that in order for humanitarian to function, they need stability, a relative stability. And that means they need to pause or resolve conflict within their communities in order to allow humanitarians to function. So actually in that way, peace building paved the road for humanitarian assistance and development. The other interesting program that we did was the community dialogue approach. And the community dialogue approach is a way where we kind of like merge development and peace building. I remember when I was the country director and I developed this approach, there was a resistance even from within Search, saying that this is not peace building, because the idea was that we identify basic needs, and this could be water, health, or whatever, and we address those needs. But the thinking was that in order to achieve stability and peace in a certain context, we need to have a tangible change. People fighting over water, even if you sit with them and help them to see the problem and think about alternative means to redistribute water and manage water resources, whenever there is a scarcity of water, they will go again and compete and fight. But if you help them to resolve that scarcity, but in a way where you use that as an entry point to rebuild the social cohesion and rebuild the governance structure and rebuild their ability to work collaboratively, you actually achieve double things. So you provide a basic service, but at the same time, you recreated, healthy relationship and collaborative that's actually helped them to do other things. So in this way, when you think about development is there to address like structural issues within the context, but by doing that, rebuilding peace infrastructure, it has more profound impact, because it's helped also the people to continue practicing that new behavior and that new approach for the future. Next slide, please. Another thing that we are doing, and this ones we are doing in Yemen, but also we're expanding to the region. So one of the challenges we find that's in regards to why development or humanitarian assistance, mainly humanitarian assistance, do not apply conflict sensitivity. We see it that conflict sensitivity is an integral part, at least do no harm, within many humanitarian assistance. But because of the short-term nature of humanitarian assistance, the constraints, the difficulties they face, they need to achieve something within 6 to 9 months, and the context shifting very rapidly. And there is always a problem with conflict sensitivity that you might have the concept, you might have the guidelines within your organization, but bringing that and operationalize it in the context, meaning that adapting it to a context of Yemen, Iraq, or Lebanon, building local resources around it, is comprehensive work, and you need time to do that. And organizations sometimes do not have the resources or don't have the time to do it. So the idea was that if we can provide an ad hoc support structure that actually help these organizations doing that, meaning that we had in Yemen, we have the Yemen Conflict Sensitivity Platform. So the platform actually conduct context analysis and track like interaction between humanitarian developments and the political and social context. We provide capacity building for the staff. We coordinate between different organizations by allowing them to share learning. We also work with the donors to coordinate and help the donors to see opportunities for conflict sensitivity and supporting peace. In that way, we make it much easier for these organizations to adapt it. So we create kind of like a space for coordination between those different sectors. We have what we call it a technical working group, where humanitarian development and peace building organizations sit together to talk about how can we change this context? How are we impacted? What are the different options that we have? And they learn from each other. Humanitarian organization has lots of experiences as the oldest within this context, development also have a wide range of tools. Peace building and newcomer also have an interesting approach. So mixing those three make lots of sense. And this is not only unique to Yemen approach, which we are now doing. Mina, there is like South Sudan example. There is something is happening in Libya. So having that kind of like additional support for humanitarian development organizations to actually move into this nexus thinking and utilizing conflict sensitivity to build within their programming gene. My final remark in this ones is that the objective that humanitarian development and peace building has at core is to transform a context and change a context of need and structure of problems into a context where people collaborate and problems are solved with no violence. And in order to get there, we need to work together. It's not, one sector cannot solve that. And I think we had already accumulated enough knowledge between those three different sectors to know that. And it's now, I think the time and the momentum is there. We start seeing the donors starting to talk about it. What is needed is now to bring it into the operational level and back it and make it something usable at the country level. Thank you.
Oh, thank you so much, Shoki. It's the triple threat, really. I mean, I think that really underscores what we've been talking about, the complexity of things and how we really need to be looking at a number of different aspects at one time. Thank you so much for your comments. Now we have two things going at once now. We put up the last final question of today based on our discussion today. What can you do to advance the humanitarian to development nexus? One of the things we've learned is to add peace building, look at different sectors. I'm going to ask Cammi and Sarah very quickly, just what was the highlight for you from the call today before I call on Patty and Michael to give closing comments at the end of the call. Cammi, what was it that stood out to you?
Thanks, Julie, and thanks so much to our presenters for the case studies. They were really helpful and just really encouraging to see how our programs are starting to adapt in the field. I appreciated hearing from both of you that the programs are really rooted in the community levels and establishing relationships with those key stakeholders early in the project and sort of ready with a plan to respond to some of these risks and challenges that we see in these protracted crises. And I think my takeaway is that just the adaptive management components are so critical for these projects, and that they need to be grounded in the needs of the communities that we serve, and the relationships with the governments and other stakeholders need to be at play early on. And so I hope that we can dive a bit deeper into the discussions around adaptive management approaches in our task force moving forward. So thank you so much for that.
Thank you, Cammi. Sarah, what was the highlight for you today?
I think what was really exciting was seeing some of Patty's comments sort of operationalized in some of the field examples about really hearing what the communities want and ensuring that programs are grounded and responsive to those community needs and leveraging existing community platforms to adapt and respond to what to respond to COVID. And so that was really exciting to hear, and I think sort of underscores that interest in the poll to learning more about adaptive management, particularly in this COVID climate. So I think it presents a really great opportunity for us to hear that and think about how we can reflect that in the programming that we're putting together for the year.
Thank you, Sarah. And as we start 5 minutes after the hour, we usually end 5 minutes after. So we have 4 more minutes, 2 each for Patty and Michael. And what I'd like to ask you to do is just take a couple of minutes each. We'll start with Patty in terms of any kind of highlights and or anything, any takeaways that you'd like to share with the audience. Patty?
Well, I mean, I think the biggest takeaway is we are doing this to some degree, countries are doing this to some degree, and I think we do need to celebrate that. I feel as a sector, we love to kind of beat ourselves up but really one, to recognize that, to highlight what can we do, what more should we do more of. And I think the other thing I'd like to kind of, it's just what, kind of talking to your question about what can you do to advance. I mean, I will just personally continue to call it out for what it is. Like, let's stop talking about things and being so obsessed with the wording or what we call it, and actually let's focus on what it is and how to do it. And this, a little bit for me, is the same as the accountability to affected populations, which for years in the IASC meetings, I would have different principals or number twos from different agencies, UN and NGOs, but usually, unfortunately, the UN, sorry to bash on them a little bit. And they would say to me, well, what is accountability to affected populations? Like constantly getting focused on the wording and the terminology and making sure it was a checklist that they could, let's stop bureaucratizing our work. Let's stop bureaucratizing our values. Let's actually live them. Let's practice them. And I think the results of what we want will come from that. I mean, Julie, you and I started back in the cowboy days of humanitarian assistance. I think we've professionalized, and that's great, but it means that sometimes we've lost touch with people being at the center, with values and commitment to what we're doing being at the center, and being willing to call it out when we're moving towards checklists and forms and presentations and programs that all look pretty for the donor. Let's challenge ourselves to actually do that, what's needed, and find the narrative of how that looks after. Because I do think deep down we all know what this is. We all know why this is important. But where the divisions start coming up is when we start looking at what does it mean to me, what definition, what acronym, what donor. That all becomes complex. And I think if we can really agree on the concept and the necessity for it, if we can begin there in the goal, the paths may be different by which we achieve it, but we will all get there.
Thank you kindly, Patty. And Michael, I'd like to give you the last word before I formally close.
Thank you. For me, this has been really very rich and illuminating. Thank you so much for putting this together. I have 2 takeaways to share. I think one is, I really have appreciated, Patty, your consistent focus on people-centered. I think that, this is just so vital. The solutions to so many of the challenges that we're all globally trying to tackle in our own communities and communities around the world, it starts with people and people's own understanding of what they're facing and the solutions that they're seeking to leverage to cause change. And then for me, the second kind of takeaway here is the question that kind of kept running through my head is what will cause enduring change? And I think that part of what we're grappling with in this humanitarian development and peace nexus is that idea that humanitarian actions are reacting to crisis development are trying to put in place institutional and other sorts of structures, economic structures, which bring people out of poverty, and peace is about the processes through which people individually engage in their systems that are around them. And for me, it's very practical. We can call it all the different things we want. And I so appreciated your comment that we can have a triple this and a triple that. The question is, how do we cause enduring change that lasts and enduring processes that last? And how do we leverage all of the resources that are coming at our field to be channeled in that direction? I think that COVID has laid bare a lot of our gaps and is equally as powerful an opportunity for us to transform as any that we've had. And I think we need to take advantage of the moment. And if we don't, then, then we're just focused on ourselves, as Patty said. So thank you.
Well, yes, thank you all. This is just to say that we always like to try to shake things up. Today we had closed captioning. We did a fireside chat, if you will, a round table. We actually discussed and engaged. Michael, you've been such a wonderful inspiration for us. And as I said before, a thought leader. Patty, one of my most esteemed colleagues and friends for many, many decades. I thank you for joining our co-chairs, Sarah Kellogg and Cammi Blackburn, and our wonderful case study presenters, Shoki and Roisin. I have some resources on the last slide. Again, our Michael Shipler is also an author. I'm sure he's a beautiful writer. I encourage you all to check out his book. And I thank you for joining us, and I wish you all a safe day, a great weekend, and please join us again when we will be in conversation with others in the future for our next calls. Thank you all. This call is now officially closed.
You too.
Thanks a lot.
Thanks, Patty. Great to have you.
Yeah, thanks
As the
everyone.
Mona Lisa once said.
Yeah, exactly.
I'm in the heart chakra room.
Lovely.
Thank you.